New this morning, all forms of cancer, they're bad. Lung cancer is the biggest killer, and it's even worse in Mississippi. 20% of adults in the Magnolia State smoke, almost the highest in our country. Mississippi also ranks poorly in a new report for the number of new lung cancer cases. This morning, we are joined live by Dr. Raymond Osarogiagbon in Memphis. He's an oncologist and the chief scientist for Baptist Memorial Healthcare. Good morning, and thanks so much for joining us.
Good morning, and thank you for having me.
So why do you think Mississippi ranked near last for the number of new lung cancer cases?
Well, unfortunately, smoking is still socially and culturally acceptable in our region of the country. We're in the tobacco belt. But the other part of it is our social policies are some of the loosest in the United States. So we could do with tighter policies to encourage people to quit smoking and discourage people who don't smoke from taking up the habit.
Right. And I should also include in that question, we're also last when it comes to the percentage of smokers and the survival rate in the new American Lung Association report, which is something we talked about recently. But what kinds of lung cancer screening services does your hospital offer, and who's eligible?
Yes, we have 22 sites across the region where people can go for screening for lung cancer. People who are eligible are anybody who's 50 to 80 years old, who has a history of smoking, whether they still smoke or they have quit within the last 15 years. We encourage to talk to their primary care doctors whether they should go get a screening test. And screening is covered by all insurance without a copay.
Good to hear. What are some of the reasons that African Americans seem to have less favorable outcomes in the areas of lung cancer diagnosis and survival?
One word: access. It's all about access. African Americans, people who live in rural areas, the people with lower socioeconomic opportunities, all are at high risk for lung cancer and all have trouble gaining access to good quality care.
Yeah, I can imagine what it's like for folks who may be in the Delta, more rural parts like that. We do have some in our portion of the state, but I know there are more rural areas across Mississippi that may struggle with that. Now, you know, when it comes with any bad habit, you hear people say, oh, I'm going to stop this, I'm going to stop that, and they may try for like a week and then they're back to their old habits. But how can people stop smoking, or how much can quitting smoking improve someone's chances of avoiding lung cancer? I apologize. I'm sorry. It seems that we've kind of lost your audio there a little bit. Do you mind repeating your answer for us?
So, people who quit, if you look at people who successfully quit, it takes anywhere from 7 to 15 attempts to be able to finally quit smoking. So we encourage people not to be discouraged, okay? Reach out for help. There is a lot of support that's available to people in Mississippi to help them quit smoking. Don't try to do it by yourself. And don't be discouraged if you try and fail and try and fail. Just keep trying. It is well worth the effort.
I love that, and I think it can go unsaid. Folks need to keep trying, and I do believe that is where we all get discouraged. I mean, even when it comes to just, I don't know, simple habits, whether like people want to cut out junk food in their diet, or I mean, that's not really simple, but you know what I mean. Well, thank you so much, Dr. Osarogiagbon, again, for joining us this morning. I know it's early and it's cold outside, but we really appreciate it.
Pleasure. Thank you.